A lot of doctors don't even think it's real. That's right. And not just doctors, a lot of healthcare professionals, even people, patients, many don't think this is real. We're talking about chronic Lyme, also called post treatment Lyme disease syndrome. That is the term the medical community has given to chronic Lyme, which a lot of people call it. Let's just take a step back, okay? So, Lyme disease, just to remind ourselves, it's a disease that's caused by an infection with a bacteria that's transmitted by the bite of a tick. There are certain regions of the United States that are more prone to, Lyme transmission and have more cases of Lyme disease than others. But suffice it to say, that is essentially what Lyme disease is. Lyme disease can cause a number of symptoms, from muscle pains, weakness, rashes, etc. If Lyme disease is left untreated, it can affect other parts of the body. It can advance to affecting the neurological system, the heart, and other organs as well. Can become very, very serious. It is a serious condition and disease to treat, no matter what, whether it progresses or not. Now, what you should know is that most cases of Lyme disease are treated perfectly fine and treated adequately with a 2 to 4 week course of oral antibiotics, sometimes even less than 2 weeks. So it's important that we say this, that Lyme disease itself has treatment. We give an antibiotic for this, okay? And this is something I do in my office. I've been treating patients with Lyme disease for years because it's something that I see in my part of the country where I practice. Now, when we're talking about chronic Lyme, or more accurately, post-treatment Lyme disease syndrome, we're talking about patients who have been treated with an appropriate course of oral antibiotics, but still have symptoms after receiving treatment. These symptoms can be a number of things, from pain to fatigue, weakness, brain fog, sleep issues, sometimes difficulty thinking. And honestly, for a lot of patients who have these symptoms, who report these, their quality of life is affected quite greatly. Generally, the symptoms last for 6 months, more than 6 months rather, after they finish treatment. Again, this is what's called post-treatment Lyme disease syndrome. I want to just stop here for a moment and ask you guys, for those of you who are watching, number one, do you know someone who feels they have chronic Lyme or post-treatment Lyme disease syndrome? Do you have this yourself? What are your symptoms? Please write in the comments. Now, this is the thing. I told you from the beginning that there are a lot of doctors who don't believe in this, a lot of medical professionals who don't, a lot of patients and public who are skeptical as well. When we talk about these symptoms that remain even after someone's been treated for Lyme disease, treated appropriately, the question then is, well, why is this happening? Okay. And the truth be told, this is according to the CDC, the cause is not entirely known. There are some experts and people who believe that the bacteria that causes Lyme disease, actually triggers an autoimmune response that causes the symptoms that last after the infection is gone. And we should note that autoimmune responses have been known to occur after other infections, so that's not like a completely unique idea. So maybe that's what's going on here, some hypothesize. Other experts say, well, maybe there's a persistent infection from this bacteria that maybe we just can't detect, etc. Maybe that's why people are still symptomatic. Some people actually believe that the symptoms of post-treatment Lyme disease syndrome are due to other causes that are not related to the patient's infection, which has caused Lyme disease. So, again, there are a lot of theories out there. These are just some of them, but the truth of the matter is we don't know for sure. Now, there have been a number of studies done. I shouldn't say a number. There have been some studies done. We need more studies. We need more and more data about this. And there are researchers and centers that are focusing research on this, which is good. There have been some studies that have been funded by the NIH that have found that long-term outcomes are no better for patients who got prolonged antibiotic treatments than for patients who got placebo. Sometimes people or physicians have thought that prolonged antibiotics would be helpful in this situation, but the studies have not shown that that's necessarily the case. And we have to remember that prolonged antibiotics are often associated with potential complications, side effects, etc. So, it doesn't seem that that is the way out of this. But I think what I'm trying to say, and what I think is important to say here, is that this is something that needs more study. We need more information. We need more data. Now, the CDC does say that people with post-treatment Lyme disease syndrome typically get better over time, but honestly, it can take months or even longer for people to feel completely well. And I've known people who say they have this and they still don't feel better, and it's been years. So we need to understand better what's going on and how to help people who feel that they have these symptoms after being treated for Lyme disease. I want to know what you think. I want to know your thoughts. I want to know your experiences. Let me know them in the comments. I have other videos about Lyme disease. I think it's an important condition, something that I'm always staying on top of because, again, I treat a decent amount of it in the part of the country where I practice because it tends to be something we see in the Northeast. But yeah, I want to know what you think. This is something that we just need to learn more about. So make sure you write your comments in the comments. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. For those of you on Facebook, please like and follow my page. For those of you, also, by the way, for those of you who send stars on Facebook, thank you so much. Consider joining my subscription group as well for exclusive content. And for those of you on YouTube, please subscribe to my channel. Click the little bell for updates as well. Guys, I'm Dr. Jen. Also, check out drjencaudle.com for my free health newsletter and so much more. All right, guys. Love y'all.